All right, let's dive into the first topic, understanding the causes and transmission of strep throat. Strep throat is a common bacterial infection caused by the Streptococcus pyogenes bacteria, also known as Group A Streptococcus. This bacteria is responsible for a variety of infections. But when it comes to strep throat, it specifically targets the throat and tonsils. Now, how does this bacteria spread? The primary mode of transmission is through respiratory droplets. When an infected person talks, coughs, or sneezes, they release tiny droplets containing the bacteria into the air. These droplets can then be inhaled by nearby individuals, causing them to contract the infection. It's quite easily transmitted, especially in crowded environments like schools and workplaces. In addition to respiratory droplets, Streptococcus pyogenes can also spread through contact with contaminated surfaces. If an infected person touches a surface like a doorknob or table, the bacteria can be transferred and survive for some time. When someone else touches that same surface and then touches their face, particularly their mouth or nose, they may introduce the bacteria into their body, leading to an infection. So to sum it up, strep throat is caused by the Streptococcus pyogenes bacteria, which spreads mainly through respiratory droplets and contaminated surfaces. It's essential to be aware of this mode of transmission to prevent the spread of infection and protect ourselves and others around us. Moving on to our second topic, let's talk about the common symptoms of strep throat and how to distinguish them from those of a viral infection. Strep throat can be quite uncomfortable, and recognizing the symptoms early on can help you seek timely medical attention. One of the most prominent symptoms is a severe sore throat. This pain typically comes on suddenly and can make it difficult to swallow or even talk. You might also notice red swollen tonsils, sometimes with white patches or streaks of pus. Another common symptom is a fever, which can range from mild to high. This is your body's way of trying to fight off the infection. Along with a fever, you might experience chills, headaches, and general body aches. Swollen lymph nodes in the neck are another telltale sign of strep throat. These nodes may be tender to touch and can sometimes be seen as small bumps under the skin. Now, it's essential to distinguish strep throat symptoms from those of a viral infection, such as the common cold. While both can cause a sore throat, viral infections often include symptoms like a runny nose, cough, and sneezing, which are generally not seen in strep throat. Additionally, the sore throat from a viral infection is usually milder and develops gradually, rather than the sudden and severe pain associated with strep throat. In conclusion, if you're experiencing a severe sore throat, fever, headache, and swollen lymph nodes, you might have strep throat. Remember, it's important to differentiate these symptoms from those of a viral infection, as the treatment for each is different. Now that we've covered the causes and symptoms of strep throat, let's discuss the importance of timely diagnosis and treatment to prevent complications. First, if left untreated, strep throat can lead to more serious issues, such as rheumatic fever, kidney inflammation, and even scarlet fever. This is why it's crucial to get a proper diagnosis and start treatment as soon as possible. To confirm a strep throat infection, your healthcare provider may perform a rapid strep test or a throat culture. The rapid strep test involves swabbing the back of your throat and checking for the presence of the Streptococcus pyogenes bacteria. This test can provide results within minutes, but it's not always accurate. If a rapid test comes back negative that your symptoms strongly suggest strep throat, your healthcare provider might order a throat culture for further confirmation. A throat culture is a more reliable method to identify strep throat. It also involves swabbing the back of your throat, but the sample is sent to a lab where it's allowed to grow for a day or two. If the Streptococcus pyogenes bacteria is present, the lab will be able to identify it, and your healthcare provider can then prescribe the appropriate treatment. In conclusion, It's vital to get a timely diagnosis and treatment for strep throat to prevent complications. Rapid strep tests and throat cultures are essential tools in confirming the bacterial infection and ensuring the right course of action is taken. Let's move on to our fourth topic, exploring the various treatment options for strep throat. Once you've received a confirmed diagnosis, it's essential to start treatment right away to prevent complications and alleviate symptoms. The primary treatment for strep throat is antibiotics, which help kill the Streptococcus pyogenes bacteria and prevent the infection from spreading. The most commonly prescribed antibiotics are penicillin and amoxicillin. It's crucial to take the full course of antibiotics as prescribed by your healthcare provider, even if your symptoms improve before you've completed the medication. Stopping antibiotics early can lead to a recurrence of the infection and increase the risk of antibiotic resistance. In addition to antibiotics, there are several over-the-counter medications and home remedies that can help ease your symptoms. Over-the-counter pain relievers like acetaminophen and ibuprofen can help reduce fever and alleviate the pain associated with strep throat. Throat lozenges or cough drops can also provide some temporary relief for a sore throat. As for home remedies, you might find comfort in drinking warm liquids like tea or soup, which can soothe your throat. Gargling with warm salt water can also help reduce swelling and discomfort. Using a humidifier to add moisture to the air might help as well, especially if you live in a dry environment. In summary, treating strep throat typically involves antibiotics, such as penicillin or amoxicillin, along with over-the-counter medications and home remedies to help ease symptoms. Remember, it's essential to follow your healthcare provider's recommendations and complete the full course of antibiotics to ensure a successful recovery. Finally, let's discuss our fifth and last topic, preventative measures to reduce the risk of contracting and spreading strep throat. While it's impossible to completely avoid exposure to the Streptococcus pyogenes bacteria, there are certain steps you can take to minimize your risk and protect those around you. First and foremost, good hygiene practices are essential. Frequent hand washing with soap and water for at least 20 seconds is one of the most effective ways to prevent the spread of germs, including the bacteria that cause strep throat. Make sure to wash your hands before eating, after using the restroom, and after touching common surfaces like doorknobs or keyboards. Another important aspect of good hygiene is practicing proper respiratory etiquette. Cover your mouth and nose with a tissue or your elbow when you cough or sneeze to prevent the spread of respiratory droplets. Dispose of used tissues promptly and wash your hands afterward. Maintaining a healthy immune system can also help reduce your risk of contracting strep throat. Eating a balanced diet, getting regular exercise, staying well hydrated, and getting enough sleep are all essential components of a healthy lifestyle that can keep your immune system strong. If you know someone who has strep throat, try to avoid close contact with them until they've been on antibiotics for at least 24 hours. This reduces the risk of catching the infection from them. In conclusion, while it's impossible to completely avoid exposure to the bacteria that cause strep throat, adopting good hygiene practices and maintaining a healthy immune system can significantly reduce your risk of contracting and spreading the infection. Stay vigilant, take care of your health, and protect those around you.